Nearly half of American adults suffer from hypertension. Is this you? Find out more on this episode of Inspire Iredell.
Welcome to Inspire Iredell. I'm Megan.
I'm Anna.
Today we are delighted to have with us Dr. Harlan Hicks. Welcome, Dr. Hicks.
Hello, thank you.
Yeah, Dr. Hicks is an internal medicine physician at Iredell Internal Medicine. He loves riding bikes and motorcycles and enjoys traveling to see family, friends, and new places. So
yeah,
I love to travel too. I don't get to do it nearly as much, but
Nor have I. I haven't been traveling much lately, but I'm heading out of town the next couple of weekends.
Oh, cool.
Nice.
Where's your favorite place you've been?
Turks and Caicos.
Oh, jealous.
Yeah, me too.
Yeah.
Did you cruise or fly?
Oh, I can't stand to be stuck inside of any place. So
Yeah.
I fly and then I spend about no more than 5 to 7 days. 7 days is kind of
That's just enough.
about the end of my ability to tolerate being stuck on an island.
Yeah.
Yes.
Yeah.
Yeah.
Yeah. All right, cool. Well, okay. So you are an internal medicine physician. So I'm sure that you see several patients that are talking to you about hypertension or high blood pressure.
Yes.
So it seems to be common these days. Is that accurate? High blood pressure?
High blood pressure is the most common way it's referred to. Hypertension is how doctors refer to it between each other, but in general, it's the same disease. It's just how it's referenced by different parts of the society.
Okay. So, I mean, I feel like everyone knows someone that's either on high blood pressure meds or is complaining about it or saying, oh, I shouldn't eat that because my doctor told me not to. So what are some of the primary causes of it?
Main cause is stiffening of the arteries. It happens mostly as we age. So as all of us age, we're going to run into problems where our blood vessels get stiffer, just like our joints.
Okay.
The vessels stiffen as well. So when that happens, blood pressure, the blood vessels' inability to relax creates a higher blood pressure, systolic and diastolic blood pressure.
I didn't know that, actually.
Yeah.
I had no idea.
Can't relax. Okay.
Yeah.
Interesting.
And when we're younger,
Okay.
the problem is more us than it is time.
Oh.
We overeat, we don't exercise.
Check.
Check.
We eat poorly.
Check.
When you're really young, you're the high school age, you can get away with a lot of stuff.
Yeah.
When you start to get around 30, 35, you start to pay a price. Now, some of it is also genetics. I have patients that are in their 20s. I think I saw a young guy who was like 24, 180 over 110.
Whoa.
So some of it is genetics as well.
Okay.
So there are multiple factors that contribute to hypertension, but most commonly what we are, dealing with is aging, stiffening of the blood vessels, just like we have stiffening of the arteries, stiffening of the blood vessels as well. But some of it is manageable. Younger, exercise is always positive.
Yes, yeah.
No matter what age, if you're able to exercise, you are helping your whole system. You increase your heart rate, you relax the heart, it allows the blood pressure to drop. And now there are a lot of times we have to use medication.
Right.
It's interesting. You said you exercise, it increases your heart rate, and that relaxes the heart.
Over time.
Over time.
Yeah.
Okay.
Yes, it's
So
not
it's like a conditioning sort of thing.
It's your putting the heart to work. So when it relaxes, it actually has a lower place to.
Oh, rather than just staying in this higher place.
Oh, that makes sense.
Okay.
It's like when runners, you've heard of runners who when their resting heart rate is in their 50s.
Yeah.
But when they're running, they're putting their heart, they're putting their blood vessels, they're adding stress to their system. But when they're at rest or at normal daily activities like walking, it's nothing for them.
Okay.
Wow.
So taxing your body for a short period of time, 30, 40 minutes, adding that kind of stress consistently allows the body to have a high peak that it's under stress, and then when it relaxes, it gives you a benefit
Okay.
for day-to-day activities. And that's why we should all exercise.
Yes.
Most of us cheat some.
Well,
Yes, of course.
Yeah.
I'm glad to hear a doctor say that. Though.
Yeah.
You know, that makes me feel a little bit better.
But
yes,
yeah.
some, keyword being some, not
Not all
every
the time.
day, all the time. Guilty.
And I'm sure it's important just to find something that you actually enjoy doing. Like if you're not a runner, you don't need to go and run a 5K.
Absolutely not. No. I mean, exercise doesn't mean running.
Yeah.
I mean, running is good, but as we age, that's another thing. You're
Joints,
you're
yeah.
taxing the joints. So walking, start walking. If you're just someone starting out exercising, 10-minute walk, increase that every couple of weeks. You're going to 12 minutes, 15 minutes. Increase how far you're walking. All of these things will help you immensely.
Okay.
Helps your heart. It helps your mental state. It's just positive.
Yeah.
You release endorphins, which relaxes the blood pressure. It initially increases it, but when you're back home and you're relaxing, blood pressure drops lower. You feel better. So there's really nothing negative about exercising.
Yeah.
Unless you've already got coronary disease, but that's a different conversation.
Different conversation with
Talk with your doctor.
cardiologist.
Yeah,
Yes.
talk with your doctor. Yeah.
So what is the goal for a resting heart rate? Because I know lots of people have different devices they wear on their wrist, or there's even rings and things like that now that will tell them what their heart rate is at various times of the day. Is
like,
there
what is mine
a
right now?
goal for what it should be?
Well, the average person's resting heart rate should be under 80.
Okay.
Now, when you're, a true athlete, we're talking their resting heart rate's under 60.
Okay.
A runner may be under 50, a long distance runner. So it's about consistency. Us in this room, if we're under 80 resting heart rate, we're doing well.
Okay. Good to know.
Mine's been 80 all day, so
There you go.
Yeah.
maybe a little less. Shoot
I
for a
know.
little under.
I saw you checking your watch over there, but I was like, I bet she's checking her heart rate. I know, right? So the key is, right, to check your resting heart rate when you're at rest. So you're sitting at a desk or you're sitting on your couch, that sort of thing. Not right after you've, like, our office is down the hill from the hospital. Not after I've climbed the hill to get into the hospital. It's probably not the best time to check it.
Good to know it then.
Okay.
So then you can test your heart rate when you're exerting yourself.
Okay.
And then you can come back and say, okay, now I've been here for 15 minutes. What's my heart rate?
Okay.
And then you can also challenge yourself to reduce your heart rate walking up that hill.
Okay.
So the more you exercise, the better conditioning that happens. And then even your exertion heart rate is lowered.
Okay, good to know. So we talk about the blood pressure. What is the ideal range? And can you tell us what people talk about? My top number and my bottom number, but what are those
that
numbers?
actually mean?
Yeah, what does that mean?
Systolic and diastolic.
Okay.
The systolic blood pressure is your heart when it's pumping blood. It's maximum contracting.
And is that the top
That's
number?
the top number.
Okay.
That's your systolic blood pressure.
Okay.
Your diastolic blood pressure is after that maximum beat, and
Okay.
now the heart's receiving blood to get oxygenated again.
Okay.
Okay.
So it's when the heart's dumping blood into the arteries for us to function, and there's a relaxation phase right after that. Now it has to receive deoxygenated blood, and that's happens during the diastolic.
Okay.
Both numbers need to be under control. That's why 120 over 80 is considered normal.
Okay.
Because if you have elevated diastolic blood pressure, there was a period of time when people talked about, well, as long as my diastolic blood pressure, my lower number is fine, I'm good. And there was a period of time in medicine that was how we approached it.
Okay.
Realized that was wrong. There was a time when it was, well, as long as you got your top number under control. So both numbers play some impact
Okay.
on I diagnose people with sleep apnea because their bottom number is elevated. They show up and they'll have 130 over 95 or 150 over 100, And I'm trying to figure out, why can't I get this person's blood pressure under control? Medication's not working. They are having problems with sleep apnea.
Oh, wow. I didn't know that could impact it.
Yeah, no, me neither.
Obesity and sleep apnea have similar issues with blood pressure.
Okay.
So my patients hate me. I'm always talking about, you got to lose weight. And it isn't, because it's not about looks. It's really about,
it's about your health.
Right.
Yeah.
Yeah, it's a problem with heart failure long term, pulmonary hypertension, where the pressure inside your lungs are higher, so just walking across the room becomes a problem.
Okay. Wow.
Yeah.
These are all great reasons to have a provider you can go and you can see regularly, or at least have like an annual visit of sorts, so you can make sure that those things
At a minimum, most of us,
control.
Once you're over the age of 30, you should probably at least get a yearly physical. Okay. And if you got family history, you should start even earlier.
Okay.
Yeah. So how would you, let's say that someone doesn't go to the doctor, they're like, I'm fine until something hurts, I'm not going. What would are there any kind of symptoms they would notice that maybe they have hypertension, and that would be like, maybe I should go see Dr. Hicks?
By the time you're having symptoms,
it's
pretty far.
Okay.
I have lots of patients that tell me, well, I can tell when my blood pressure is high. I get a headache. And I'm thinking, if you got a headache, you got a problem.
Yep. Okay.
They call hypertension the silent killer.
Okay.
And
I've heard that.
the reason is, most of the time we don't know we have a problem.
Yeah.
It's simply the blood pressure goes up. It's causing damages to lots of organs. And when you finally are getting it managed, it's heart attack, stroke. Some people even show up with blindness. They'll have you can have a clot go to the retina. You can lose vision, kidney damage. And that's one of the more common problems that you're seeing in patients in the 40s and 50s. They've had high blood pressure for years, and they show up, and now I'm telling them, well, we got to work on your blood pressure, but what's going on with your kidneys?
Yeah.
And they're like, nothing, I pee fine. I'm like, it's not just for peeing, it's a filter. And now I'm telling them that, you're already stage 2 or stage 3 kidney disease, and they're thinking, well, what did I do? I'm like, your blood pressure's been uncontrolled for years. You've probably been taking ibuprofen to help with headaches that you thought was just basic headache. So hypertension is a terrible disease, and it's terrible largely because it shows up unannounced. It's not like your gallbladder hurts and you're like, I got to get my gallbladder removed.
Right.
It's just a long-term destructive disease. And truthfully, the bulk of what internal medicine docs deal with are problems people don't know they have until they show up. How many people know they got high cholesterol?
You don't until, and the cholesterol that's like a buildup, right?
It's a slow buildup as well.
Yeah.
And it, in concert with hypertension, in concert with diabetes, these things, they seem to work hand in hand to take us down. And they all sneak up on us.
Yeah. The silent killer. That is so scary.
Yeah.
Because you just don't know. That's another reason why it's so important to have a good relationship with your doctor. So you aren't taking ibuprofen every day, or what we like in the South is the goodies powder.
I'm sure the gastroenterologists love to talk about goodie powder.
Just eating a hole in my colon, probably. Yeah.
Yeah, goodie powders are just lovely. Yeah.
Yep.
So it's interesting because, talk about it being too late, not too late, it's already progressed super far. So you mentioned headaches could be something. Are there other signs or symptoms where it's like, oh, you need to get to your doctor, you need to get there now sort of thing? Or even an emergency room?
Well, I've had patients come into the office 220 over 110. And they feel fine.
Really?
Wow.
They literally feel
I feel
fine.
like my blood pressure just shot up just thinking about that.
I'm actually amazed when I see it. Just last week, I actually had to call in one of my staff members because I'm thinking, this has got to be wrong. This gentleman's blood pressure was 240 over 1. And I'm torn between sending him to the hospital.
Right.
But he has no shortness of breath. He has no chest pain. He has no headache. He feels, and he kept saying, I feel fine, doc. And so now I'm like, okay, let me treat you. Let me bring you back tomorrow and make sure you're, that we're at least bringing your blood pressure down.
Right.
Because the last thing I want to do with that guy is give him something that's going to drop him down to normal. Because then I have the likelihood of causing him problems. All of his vessels are used to being that high. I drop him from 240 to 120, he possibly have a stroke. He's gonna possibly have more issues with his kidneys because they're not being perfused. His body is used to the blood pressure being that high. It's adjusted to it.
Wow.
So,
again, the overall theme is you need to have a doctor and get this checked right there. Now, sometimes people talk about, like, I know somebody who her blood pressure always seems to shoot up when she goes to the doctor. And she's like, I can take it at home and it's totally fine. And what is that, like white coat syndrome? Yeah. So stress, pressure in certain circumstances can make your blood pressure rise?
Absolutely. And we're aware of white coat syndrome. So what I do when patients have that concern, I listen. I'm like, okay, that's a possibility. I'm also looking at their heart rate because when you're in a stressful situation, your blood pressure spikes, but so does your heart rate.
Oh, okay. So you can kind of see whether or not
I'm like, okay,
it's
if both things are up, I'm like, okay, but I'm still going to listen to them. So I said, okay, this is what we're going to do. You're going to bring your blood pressure cuff monitor in, and we'll check it with yours. You'll check it with ours.
Oh, okay.
We'll compare both, and if the numbers are the same, I can trust it. Even if the numbers are different, but we have a specific range. Yours is 10 points lower than ours.
Okay.
Add 10 points to your number, because now we know that your meter is the problem.
Okay.
But I trust but verify when it comes to white coat syndrome, because sometimes that is the issue. Some people are needles for the same reason. People faint when they have to get shot.
Anna,
these are real things. So
that girl over there cannot give blood.
Yeah.
No, I can't. I can take a shot, but for some reason, I have this intense vasovagal reaction to giving. I don't give blood voluntarily. Whenever I came for my employment screening, they only took 2 vials, and I was out. They laid me down.
Yes.
I had a fan. I had a snack, and I still went out.
Snacks.
Yep.
Yeah. That's funny. I had a Marine in my office yesterday. He had to lie down to give blood.
Oh no!
He literally, big guy, he's like, I'm telling him to go over. We're gonna get some blood, and then he looked at me, and he looked over. And he's like, but can I do it in here? I was like, is there a reason? He's like, well, it's better if I lie down.
Yeah.
I was like, okay, that's fine. I hate needles myself. I understand.
You really?
I hate needles coming at me.
Okay. I was about to say, how do you do what you do every day?
No problem.
Oh, man.
Giving someone else a shot, drawing blood.
Yeah.
Blood doesn't bother me. It's someone sticking a needle in me. That's the problem. Even if it's a shot or drawing blood, I hate needles. Yeah, I'd be a horrible drug addict.
Yeah. Absolutely.
That's good.
Yep. Good to hear, right?
Good to hear, yes.
So you talked about having a way to check your blood pressure at home. What do you recommend for that? Because I know there's so many different things.
I wish that I could tell you just have to try the different ones. And my idea is that if you buy one and you have a relationship with your doctor, bring it to your doctor's office. Have them compare their numbers with your meter's number. And I personally don't even trust our electronic meter in the office. My staff knows that I prefer manual monitoring of the blood pressure, because if they check it with that, I'm going to check it with my own cuff anyway, and I'm going to trust my reading over an electronic meter.
So what do you... I've never taken someone's blood pressure manually. I've used the little wrist things and all that. So whenever you are checking someone's blood pressure and they have their stethoscope right here, what is that listening for?
You're listening for, you have the person sit down comfortably, feet flat on the floor.
Okay.
Legs not crossed, you not tense. You just want them sitting back, relaxed. And you pump the meter up, the cuff up, be as high as possible without hurting. Now, occasionally, when I'm first checking someone, if I'm checking you for the first time, I'm going to go up pretty high because I don't know what your systolic peak is. So I'll probably go up to 200. If I go up to 200 and I'm bringing, and I start listening, and at 190, I hear that first sound, I will stop and go up higher.
Okay.
Because it may be your blood pressure is higher than 190. It may be 210. So you go beyond where you're gonna think you're gonna hear any sound, and then you start bringing the cuff down slowly. And when you hear that first beat, that first consistent sound, that's your systolic number. That's the first number you write down.
What's the beat that you're hearing?
I'm hearing the pulse. I'm literally hearing the pulse. I'm having pressure on it. I've constricted it to the point where, as I'm releasing pressure, now I finally hear that first tone, and that first pulse is your systolic number. I keep going down. I'll hear that number all the way down until I hear no pulse. That's your diastolic number.
Oh.
So it's not as hard as people think.
Yeah,
that's why there's like the little dial on
on
the cuff. Okay, interesting.
Yeah, I've always wondered why. So whenever they're taking your blood pressure, is it important that you wear like a short sleeve shirt, or does it really matter?
A lot of people will take a blood pressure through a shirt. You probably can.
Yeah.
I don't trust it.
Okay.
I don't trust my ear well enough, nor do I trust your ear well enough if you're working for me or with me. So if you can bring it up so I can at least get my stethoscope here. I also think as thin as that shirt, being able to put a cuff above it, no problem. But being able to put my stethoscope on your skin matters.
Okay. Yeah, that makes a lot of sense.
Yeah, I've had it both ways where I've been like this is a thin sweater, right?
Yeah.
So but they will have me like roll it up here. At least they can put the cuff, but roll it up there. And then other times where I have to like take my arm out of the sleeve, whatever. So
that's probably the better approach, is to literally have the cuff on your skin.
Okay.
So that's what I try to. Yeah, that's what I try to do. There are just some patients you just can't. I have elderly patients that don't move well, that come in dressed a lot, and so I'm respectful of that. But if I get the opportunity to check their blood pressure without something on their skin, that's my preference.
Okay.
Always.
Okay.
So at what point? How often do you have patients that implement lifestyle changes, healthy eating, and exercise, and then you can take them off of their medicine?
I did it yesterday.
Oh, yay! That's good.
I literally, when it happens, I'm always surprised. I'm always excited because I have so many patients. Oh, I'm gonna lose weight, doc. I'm gonna exercise. I have a patient that I remember, a lady from years ago. She came in. She was diabetic and hypertensive. She said, "I don't like medicine. I'm gonna get off of it." And I'm thinking, yeah, whatever. I'm thinking to myself, sure.
We all have great aspirations when it comes to diet and exercise.
This woman started riding a bike. She lost weight, stopped her diabetes medicine, stopped her hypertension medicine. I'm like, you are a rock star.
Yeah. We need her on a billboard. Call her
I
out.
honestly would have posted her. She was that impressive.
Yeah.
I still see this woman. She's an amazing, she's really cool. I'm like, wow.
Yeah, that is cool. Willpower, too.
Now,
that's a total lifestyle change.
Yes. Now, the gentleman I saw yesterday, I saw him in January. He was 288 pounds. He was 229 pounds yesterday.
Whoa.
Amazing.
Yeah.
Stopped his blood pressure medicine.
Wow.
His blood pressure was 130 over 80. And I'm saying, that's not completely perfect, but you got to get a reward for your skills. And he's like, yeah, I got another 20 to lose. I'm like, you're the man.
Yeah.
In that short period of time, you gotta pat him on the back.
Yeah.
So yeah, it happens. It's not as much as I'd like, but it does happen.
You almost need like a hypertension support group.
Yeah.
Do you know what I'm saying? I mean, there's so many support groups
of different things.
That would be a really full.
Yeah.
Be very.
Yeah.
It's like everyone
support groups for hypertension.
Multiple times.
Yeah, I don't think that'll work.
Dr. Hicks, you talk about people coming off their medicine, but I think it's probably important to note they should not just take themselves off the medicine, right? That needs to be at the direction of their provider.
Absolutely.
Oh, without question. And I think most patients are starting to recognize, at least my patients will call the office and say, hey, my blood pressure is this and I'm feeling lightheaded. Is it all right if I stop? And I'm recognizing that people are taking it serious.
Okay.
They're they have family members that have had strokes or heart attacks, and they really are. The fact that you took the time to come to a doctor is the first thing. So now you've come to a doctor and they've told you, look, you've got this problem we can't ignore. And I respect their taking the time to say, hey, should I do this? This is my number. Can I stop this medicine? And I work with patients. I'm like, yeah, let's stop it. Let's see what happens. Come in next week. We'll see if you're still under control. So I don't want you on medication either.
Right.
But I don't want to see you have a stroke or a heart attack either.
Right.
Okay.
And
So that family history side of things, what are the things that you need to be concerned about for family history?
I mean, most of the time, we know who has high blood pressure, diabetes. In our families, we our mom, our dad, our first-degree relatives, first or second-degree relative. Most consistently, it's first-degree relative, being a sister or brother or mother or father.
Okay.
But if you have your mother, your grandmother, your aunt, there's a problem.
big history.
And so that's someone who needs to be talking to their doctor. And often it isn't just hypertension. It's often diabetes. And more often it's even lifestyle. We tend to eat what our parents
True.
ate.
Yeah.
We tend to share similar diets, similar activities. We tend to do that. And so it leads to similar outcomes.
Okay. Good to know.
Well, I have learned so much about blood pressure. I thought I
too.
knew about blood pressure.
Yeah.
I do not. I did not. I do now.
Yes. We are
I
much more
really
educated
thank you
now.
so much for being here.
No problem, Ma. This was fun. I enjoyed it. It's nice to be able to talk about something that matters to me. I mean,
Yeah.
I love talking about various things in healthcare because we see such a diverse population of people, and this community can use a lot of support, and I'm glad there are lots of great doctors here. So.
Absolutely. If you need a primary care doctor, are you accepting new patients, Dr. Hicks?
Of course I am.
Absolutely.
I'm
Okay.
definitely accepting new patients.
So IredellInternalMedicine.com, or you can call the office. You can find the phone number on that website. I don't know it. Do you know it?
Not off the top of my head.
Okay.
I don't.
So IredellInternalMedicine.com.
But we'll put it in the caption.
Yeah, we can put it in the
Yeah.
caption, so you can give Dr. Hicks's office a call and establish some care with him. Like I said, thank you so much. We've learned a lot. I hope that you've learned a lot, our audience, about hypertension today, and we will see you next time on this episode or the next episode of Inspire Iredell.
Don't forget to like and subscribe.
Yes.
The content here is for informational and educational purposes only, not for medical advice. Consult your qualified healthcare professional for specific health concerns and questions.